What do you want to be? What job do you want to pursue in the future? It has only been 2 months since the start of my junior year, but I can't even remember how many times I've heard this question. My name is Erica Song, and growing up in South Korea, where academics were valued more than anything else as a student, attending an international school gave me new perspectives on diverse cultures and values. Nevertheless, being exposed to different cultures or having different social backgrounds doesn't provide students with a definite answer regarding what they want to pursue in the future. From my point of view, we're students, people who can have an excuse for being inconsistent and still need time to dream of different people we want to become. Yet, I don't want to be completely clear here. Getting out of your comfort zone and walking out to experience something unique unquestionably shapes who you are and will affect the decisions you make for your future self. From a young age, visiting the dentist was like a routine. When I was 7 years old, I saw a dentist for a checkup just after one of my baby teeth fell out. No one knew until then that my permanent tooth was going upwards, not down. That was when I had my first surgery, removing the pointy tooth that was about to thrust my nose if not examined by the dentist. Continued by that striking event, that 7-year-old girl had to get another adenoid removal surgery. My enlarged adenoids partially blocked my airways, causing trouble in breathing and sleeping. Specifically, I had problems with breathing in my nose, which caused me to get surgery that left me with pain that I still remember at 17 years old. This was not the end. Since 5th grade, I had to get braces on for 5 years. Most of my teeth weren't aligned, and some were in the wrong spot. Getting braces was a common thing among my friends, but most of them got it just for 2 to 3 years. Although I'm describing this experience in just a few sentences, the process I went through, having my braces on, touched upon my self-esteem in various ways. The few events I just listed are something that no one could have changed. It was something that came naturally to me. However, these experiences sparked my interest in the health field, triggering me to think about the underserved population. All those incidents could have happened to other people as well. Thus, a few questions came into my mind. 1. How will those people handle such a burden? 2. What can I do to help? That is when I started researching for medical volunteers that high schoolers can join. As Korea is not a country that easily allows volunteers in the specialized field of medicine, opportunities were limited. However, the one that I found in the summer before rising sophomore year provided me with new experiences and knowledge regarding the current medical status of seniors and other marginalized populations. Each month, I visited the area where many senior populations lived. About 40 to 60 patients came each month for checkups and medications. My role there is to work in the reception area, where I'm the first person to greet people. But I also make charts for each patient and record the information of patients who come each month. Initially, I wasn't used to the work I had to do, and the environment was so new that I didn't have time to interact with the patients. However, after joining the volunteer session for over a year, I became comfortable with my role in the new space. With the help of time, I learned new skills for the work I was assigned and established connections with patients who frequently visited the place. I made it to a point where I memorized many of their names and even the characteristics of many other adults. Some of them even shared their small humor and jokes, which brought me to a sense of fulfillment, as I could be the listening ear for people who might have otherwise felt lonely and isolated. I noticed that many elderly have problems with their skin, digestion, muscle pain, and much more. Also, more than that, the elderly needed treatment with oral health and sometimes even asked me whether there was a dentist in our volunteering session. Generally, many elderly are still looking for dental care where they can get free checkups, as it is less common than medical volunteers. Thus, I think developing oral health care for people who are less economically wealthy or the underserved population is necessary. Such engagement in volunteering allowed me to develop my social skills as a medical volunteer and better understand the necessary aspects of elderly's health. Those experiences paved the way that I want to pursue. Health is a field that covers diagnosing and treating patients and where you get to build human connections and positively impact their lives. This whole continuing journey established my interest in the medical field. Nevertheless, even in the same area, everyone has different reasons why they want to pursue a career. When I asked Sophia Rhea, a second-year medical student, she told me their interest in medicine came from combining her artistic and scientific passions. She's a medical student who employs an artistic lens to view medicine and a scientific lens to view art. However, even for med students, their perception changes and evolves as they gain more experience and exposure. By actually doing the first job, they get to understand better. This is the same for every job that high schoolers want to pursue. Even if we decide on a career or a dream that we want to follow as high school students, our expectations for a particular discipline will be completely different when we face reality, whether it is positive or negative. Thus, being unsure or going through changes is totally fine. To conclude my talk, if you ask any patient what they want to be, they would say healthy or cured. These answers make what I want to be so clear and precise. I want to be the person who can help them get there. Regardless of where they came from, their resources, and their background, I want to be a person who gives them help. Hence, for students struggling or pressured to find what they want to pursue, you should get out of your comfort zone to learn and experience new things. Those experiences will act as a trigger in establishing your future self. So now, I want to ask you for the last time, what do you want to be? Thank you.